It's extremely important after your knee replacement to work hard on physiotherapy, to do the exercises that you need to make sure that the knee is as good as it can be. Now, exercises are going to be hard work. The knee will be quite sore. It'll be very important that you use the cryocuff and icing techniques to limit the swelling in your knee. It's very important that you don't go crazy with too much walking. It's important that you'll elevate your leg. All these things we'll teach you before you go home. But now is the time to start thinking about those exercises and get practicing before you come in for your operation. Breathing exercises are really important. These need to be started immediately after the operation. The idea of them is to maintain a clear and healthy chest, because after the operation, your chest is more susceptible to an infection because you're somewhat sleepy and you're lying in bed. So really important to get these exercises going. Take a deep breath in through your nose so that your stomach rises out. Hold it and then breathe out through your mouth. If you feel any phlegm in your throat and you have a cough, you should clear it with that. This should be repeated 3 times every half an hour. Ankle pumps. These exercises are great at improving the circulation in your legs. They therefore help to prevent the formation of blood clots. They help reduce swelling, and it encourages the return of normal skin sensation. And you should start these as soon as your operation's finished. To do them, you simply lie in the bed with your heels free and move your ankles up and down quite briskly, pointing your toes towards and away from you. Do this for 10 seconds and repeat it every 30 minutes. Static quads exercises. These exercises are really important in helping you to regain control of your knee, ready for standing and walking. It also helps you to get your knee nice and straight. These exercises you absolutely need to start practicing before your operation so that as soon as you wake up and are back on the ward, you can start working on them. To do these exercises, you need to be lying down or leaning back slightly in a chair. You want to pull your toes upwards towards your face while bracing your knee fully straight into the bed so that it is locked out as straight as it will go. Imagine that you're trying to squash a tennis ball under your knee. And then you hold that position with the legs contracted for 10 seconds and then you relax. And you need to be doing this 10 times every hour. So really once every 5 minutes if you can manage it. Straight leg raises. These exercises help build the muscles of your thigh to get them good and strong to help you when you start to stand and walk after the operation. You need to be lying down or leaning back in a chair. Lock your knees straight out, just as you have done with your static quads exercises. Then lift your whole leg about 10 centimeters or 4 inches in the air off the bed, trying to keep your leg absolutely straight. Hold that position for 5 seconds, then relax the leg down. Repeat this exercise 10 times, and you should be trying to do this series of 10 exercises about 3 times a day. Knee extension exercises. These are also known as heel prop exercises. The idea is to make sure that you can get your knee fully straight and keep it fully straight after your operation. Some people find that their knee wants to adopt a slightly bent position after surgery. We want to avoid this because this can lead to discomfort and long-term pain in the front of your knee. Therefore, work hard to try and make sure it still goes straight. To do these exercises, you need to lie down or lean back in a chair. You want to place a rolled up towel or something similar behind your ankle and then rest your leg on that such that the back of your knee is unsupported. The weight of your leg will then force the knee into full extension You want to rest in this position for 5 to 10 minutes. Do this 3 times a day, and that will help to make sure your knee goes fully straight. Knee bend or flexion exercises on the sliding board. These exercises are designed to enable you to get your knee bending after the operation. If you don't get your knee bending, then it'll be difficult to sit in a chair, difficult to go up and down stairs, get in and out of a car, etc. So it's really, really important that you work hard on these exercises. To do these exercises, lie on your back with a slide board under your leg and the donut placed under your heel. Alternatively, you can put a carrier bag under your foot. Draw your heel towards you until you feel a block to further movement. So hopefully you've bent your knee as far as possible. Now pull your heel up and hold it there for 5 seconds through the stiffness. Then straighten your knee slowly. Repeat this 10 times. And you should do this series of 10 exercises 3 times a day. Knee extension or inner range quads exercises. These are usually started a few weeks after your operation by the physiotherapist when they feel that your progress is good. The exercises are designed to really strengthen your thigh muscles to make it easier to get up and down steps and stairs. To do this exercise, you need to lie down on the bed with a rolled up blanket or towel under your knee so that it rests in a bent position. Then you lift your foot off the bed while keeping your thigh on the blanket and straighten your knee out fully, pulling your toes up towards you. Hold this position for 5 seconds and then lower your foot down. Repeat this 10 times and do those 10 sets of exercises 3 times a day. Knee bending or flexion exercises in a chair. These exercises are designed to help your knee bend with the assistance of gravity. Your goal is to sit comfortably in a chair with your knee at a right angle as soon as possible. It's important that you get a good bend if you're going to be able to get up and down from a chair easily in the long term. Firstly, sit in a chair or on the side of a bed. You may want to put a carrier bag or something similar under your foot to make it easier to slide the foot on the floor. Next, bend your knee as far as you can, holding it at the end of the range for about 5 seconds. If appropriate, your therapist may advise you to use your unoperated leg to help push and bend your knee backwards. Again, hold at the end of the range for 5 seconds. And you should repeat all of this 10 times. We would recommend that you do this set of 10 bends 3 times a day.